Welcome to this Fourroux presentation of Advancements in Prosthetics. We've put together this special DVD for you, the case manager, to help you understand the challenges faced by prosthetic patients, as well as the latest in prosthetic care and technology. The socket has been described as the most important part of a prosthesis. Learn the basics of lower extremity socket design, fitting, liners, socks, and more in our presentation entitled Inside the Socket. The socket is the part of a prosthesis that joins the artificial components to an amputee's residual limb. It's custom-made to conform to his or her anatomy. The socket is an environment made up of different parts that work together to secure the prosthesis safely and comfortably. These parts include the carbon fiber and plastic outer shell, a liner that makes direct contact with the skin, socks, and padding. As an amputee's body changes, so too does the fit of a socket. Patients must learn to use the parts of the socket environment properly in order to maintain correct fit of a prosthesis. Let's review some key socket design features. At Fourroux, we use the latest technology to create a socket that matches the shape of a patient's limb. The shape of a socket is important to minimizing unwanted movement while an amputee walks. The socket shape also determines how weight is distributed. In a poorly fitted socket, a patient's weight rests on just a few points that make contact with the socket wall. This isn't just uncomfortable, it can also cause injury. But by creating a total contact socket, each part of the residual limb within the socket shares some of an amputee's weight. As time passes, the residual limb will change shape and size. This is normal, but it means that there will be changes in the fit of even the best-made sockets. When the residual limb shrinks, it's referred to as losing volume. Volume is lost because of changes in diet, muscle atrophy, and other factors. When it happens, padding is sometimes used to relieve pressure points and restore the socket to a proper fit. Padding takes up space within the socket and helps to make up the difference. Placement of padding varies at different times and also varies from person to person. Fourroux prosthetists analyze volume loss and custom fit padding in patients' sockets as needed. For this reason, it's important that patients report any changes in socket fit or comfort. Another custom socket feature is the way it is cut at the top. The top edge of the socket is not flat, but rather trimmed into a unique shape. These trim lines provide support where needed, while also allowing a patient's muscles to work. The shape of both the socket and its trim lines are different between above-knee and below-knee amputees. Sockets are held in place by utilizing one of four primary methods: the pin lock, lanyard lock, suspension sleeve, or suspension belt. Each prosthesis will utilize only one of these. Now let's discuss liners, socks, and skin irritation. The liner is the covering for a residual limb that serves as the middleman between patient and socket. Its purpose is to cushion the amputee's limb from the forces that come from the socket while standing and walking. There are many different kinds of liners. They can be made of several types of material. Three of the most common liner materials are silicone, urethane, and thermoplastic elastomer, or TPE. Liners can be custom-made or prefabricated in many different sizes. They vary in thickness and flexibility. Different liners are made for above-knee and below-knee amputees. In general, liners are used to protect the residual limb. They are usually very soft and move with an amputee's body while wearing a prosthesis. At Fourroux, we choose the most appropriate liner for each patient based on his or her individual needs. Just like a socket, liners are custom trimmed at Fourroux to best suit each patient's socket environment. It's crucial for patients to immediately report any problems with the liner trim lines. Patients should never attempt to trim anything off a liner. To apply a liner, a patient should begin by inverting it or turning it inside out. The liner is then carefully rolled onto the residual limb, starting at the end, working upward. Using this method is important. The goal is to make sure no air remains trapped inside the liner. If the liner is pulled on like a sock, air trapped inside can cause irritation and skin breakdown. For those prostheses that utilize a pin lock, the pin will be attached to the bottom of the liner. It is extremely important for patients to align the pin correctly when applying a liner. As you can see with this clear socket, a misaligned pin can make it difficult for the pin to lock into the docking device. Trying to compensate by angling the pin into the dock can cause soreness on an amputee's residual limb. It may also cause the pin to become jammed in the dock, making it impossible to remove the prosthesis. When applying a liner, a patient should always check to make sure the pin is straight out from the bottom of the residual limb. If it isn't, the liner must be removed and reapplied. Above-knee or AK liners have distinct front and back sides that have been custom trimmed for each patient's contour. The front may be marked with a black line. AK patients should always check the position of the liner before rolling it on. In below-knee or BK amputees, there are two common liner difficulties to be aware of. While walking with a prosthesis, a patient may feel like his or her residual limb is lifting in and out of the socket. This is called pistoning, and it varies depending on the liner. We'll talk more about pistoning in our segment on skin irritation. Also, a BK patient may feel that his or her skin is being stretched inside the liner when weight is placed on the prosthesis. This varies depending on the socket. Patients noticing either pistoning while walking or stretching of the skin should contact us right away to discuss the cause and solution. Liners are an essential part of the socket environment. As a patient's liner ages, keep these things in mind. If an amputee's residual limb changes volume significantly over time, a liner may start to feel too tight or too loose. In order for the liner to work correctly, it must first fit correctly. Also, with use over time, a liner may begin to tear or develop abrasions. Damaged liners can cause discomfort and problems with a prosthesis. Patients noticing these things should be instructed to contact a Fourroux prosthetist right away.